Good morning, everybody. I think we're just almost there, 10 o'clock. Right? Is everybody happy to start the meeting? Everybody at home? Wherever you are, in your caravan, Qatar, wherever you might be, I don't know. Malcolm's in Newcastle. Are you still with us, Malcolm? No, he's desperately gone. He's definitely gone. Right, good morning. All right, so welcome to today's meeting, which is the Public Services Scrutiny Committee meeting. And we've got, first of all, we'll go straight into the agenda. First of all, I think it's a good idea if we all introduce ourselves for everybody else's sake. Yeah. So my name is Armand Watts. I'm the chair of this committee. I'm a county councillor for Thornwell. Penny?
Hi, I'm Penny Jones and I'm county councillor for Raglan and I'm vice chair of this committee.
I'm Hazel Eilert and I'm the scrutiny officer.
Thank you. I'm Jan Butler and I'm the county councillor for Goitrafar.
I'm Sue Riley, County Councillor for Bulwark and Thornwell, but I'm standing in for Jill Bond.
Thank you for that, Sue. Thank you.
Councillor Dale Rook, representing Chepstow Castle and Larkfield Ward.
Okay, so everybody at home is a free-for-all, really. You're all moving around. So, okay, can I read that on the screen? Oh, right, so we've got, so we've got Jane Roberts, yeah? Rogers even.
I wondered if that meant me. Morning, everyone. I'm Jane Rogers. I'm the Chief Officer for Social Care, Safeguarding and Health for the Council.
Okay. Tudor?
Good morning. I'm Councillor Tudor Thomas for Park in Abergavenny and I'm Cabinet Lead for Health and Social Care.
Okay. And you got Steve?
I'm Steve Garrett. I'm the Town and County Councillor for Overmono in Monmouth.
And Claire?
Morning, everyone. My name's Claire Morgan and I'm the Service Manager for Mental Health and Disability with Monmouth County Council.
And we've got Amanda there.
Good morning, everyone. My name is Amanda Went and I'm the Corporate Lead Nurse for Dementia for Nine and Bevan University Health Board.
Okay, thank you. And then we've got, sorry, that's Natasha. Natasha. So the type is so tiny, yes, absolutely tiny on my screen. So Natasha, please introduce yourself.
No problem at all. Good morning, everyone. My name's Natasha Harris. I'm Service Manager for Partnerships and Development within the Gwent Regional Partnership Team. And that was a mouthful, sorry.
No, excellent. Well, thank you all for attending this morning. We'll go straight into the agenda. So item 4 on the agenda, it says to discuss provision in Monmouthshire with the chair of the Dementia Board. So I believe then that we have a presentation in front of us today as well. So effectively, who's going to do the presentation? Amanda. Sorry, Amanda.
So sorry. Actually, this is a double act. Apologies from the chair of the Dementia Board, who is Tanya Strange. She's actually on annual leave today. So she'd asked Natasha and I to do the presentation, if that's okay.
Excellent.
So what we were going to do is Natasha's going to start off the presentation and then I'm going to pick up on the standards halfway through. And obviously it clears on the call from Monmouth, who's also part of our work stream. So we'll be able between us to answer any questions you may have that we don't cover in the presentation.
Excellent.
Okay?
Yeah, that sounds great. Brilliant. So what we'll do is we'll listen to that. Obviously, it'll help us with any questions. We've obviously, you know, we're being upfront and transparent about it. There were a number of questions that we fired off to Jane and the cabinet member, so they're not blindsided by anything, any tricky questions. We wanted to try and make it as easy as possible. But you know, we're not here to. Thank you. We're not here to. You know, we're here to scrutinise. We're not here to have a fight with you. We're here to listen about how, you know, understand what you're effectively doing. So if you wouldn't mind going into the presentation, that would be fantastic.
Okay, thank you. Natasha, are you okay with that?
Shall I share the screen?
Please.
Can everybody see that? Yeah?
Yes, you're sharing, Tasha.
Yeah. Brilliant. Okay, thanks very much. Okay, well, good morning, everybody. I've already introduced myself. Myself and Amanda are going to talk today about some of the work we're doing within the Dementia Board, and obviously Claire's on the call as well to answer any extra questions you might have. So I'll just go straight into it. So you're all aware of the Welsh Government Dementia Action Plan for Wales, and we very much sort of monitor this under the Dementia Board to ensure that we are sort of adhering to all the different themes, as you can see on the screen. So we've got risk reduction and delay in onset, raising awareness and understanding, recognising and identification, assessment and diagnosis, living well for as long as possible, and the need for increased support. So I'm going to talk to you a bit about the raising awareness and understanding within this. And what I should say is the Dementia Action Plan very much goes hand in hand with the All Wales Dementia Care Pathway Standards that we're going to talk to you about this morning. Okay, so I sort of lead on the Dementia Friendly Communities work across Gwent, and we've currently got a regional Dementia Friendly Community group that meet up bi-monthly. We used to have separate meetings for each local authority, but what we found was a lot of people are working cross region, and they were having to attend lots of meetings. So to streamline that and ensure that we're being more effective in the work that we're doing, we've now got a regional meeting. And I'm pleased to say we've got lots of partners that sit on this meeting, and we've got sort of people living with dementia, carers, we've got elected members. So thank you to those of you that are on the call and that have helped us with this work and championing this work for us. We've got the Health Board, Gwent Police, South Wales Fire Service, Local Authority, the Welsh Ambulance, Third Sector and community groups, and we all work together to ensure that we're creating dementia-friendly communities. And as you'll agree, there's never been a more important time for us to ensure that our communities are inclusive for people living with dementia, because people have told us when we've done lots of engagement work that the pandemic was a really difficult time for them and they felt very lonely and isolated. So we're trying to work hard with our recovery plan to find out what the community's needs are and where we can sort of improve the work we do. So the work is very supportive of the All Wales Dementia Care Standards that we're going to talk to you about today. And Dementia Friendly Communities has a standing item on the Dementia Board agenda because it's very important. And also Monmouthshire have a standing item within the regional Dementia Friendly Communities steering group. So we're all very connected to ensure that, you know, we're enabling co-production, that joint working, that shared practice across the board, and supporting the work that is going forward, really. And what I will say, there's been lots of work done in Monmouthshire. Prior to the pandemic, we were just about to create a dementia-friendly high street in Monmouthshire. But obviously that work's been delayed due to the pandemic. And we've also done lots of work with the Bridges Centre and lots of different organisations, the libraries and things like that. Okay, so we're going to talk to you a little bit about the Dementia Care Pathway Standards, and this has been developed by Improvement Cymru on behalf of Welsh Government, and it looks at 3 priority areas around the person living with dementia, the carer and the professional. Now, these standards have been scoped over a 2-year period with 1,800 people, including carers and partners, so it's been really co-produced. And the key question and the focus of this pathway standards is what will make a difference to people living with dementia. Now, initially there were over 100 standards, which, as you can appreciate, is a lot of work. So what has been done by Improvement Cymru, they've drilled it down to 20 standards, but these are very flexible. So when we hit one standard, we just pull another from the 100. So it always remains at the 20 standards, but we're always working to achieve improvement. And this is a 2-year delivery programme. So we're currently in the preparation stage for this work, which Amanda will talk a little bit about next. And this is ready for implementation in April next year. Now, the 20 standards, they're wrapped around 4 themes, which are wrapped around that person-centred care. And that's to ensure that we've got accessible support and provision, we're responsive, we look at the overall journey of the person, and also it relates to partnerships and development. And underpinning all that is kindness and understanding around the standards. So what I'm going to do now, I'm just going to hand you over to Amanda Went, and she's going to talk in a bit more detail about what the standards mean. You're on mute, Amanda.
Apologies, it was bound to happen, wasn't it? So thanks very much, Natasha. So we've got the 20 standards. So I'm just going to briefly talk to you about these because I know these papers and the documents have already been distributed, and we're happy to drill into more detail. But for the time slot of this presentation, I'm just going to give you a quick overview. Okay, so we're asked to deliver on the 20 standards. So I know we're here today to talk about Monmouthshire, but this is a pan-Gwent. This is an all-Wales model, and then we're delivering this pan-Gwent and obviously looking at each one of the boroughs to identify what we've already got to be able to deliver services that are specific to that area. So the 20 standards that we're asked to deliver on is, the first one was around community engagement. So we were asked to identify an area within Gwent where we felt there was the greatest need to identify what's working well, what needs to improve, and then how do we address delivering the other 20 standards. So we've have already had several consultation opportunities, and we've gone where we believe to be the highest prevalence of dementia, which is the Newport area. So we're looking at developing an expert by experience group and around the 20 standards. How do we deliver that in that area? And what will that look like? How do we know that area is a dementia-friendly region? So the next one, we were asked to look at the point of contact and where people were already, where we're delivering specialist topics, that there were reasonable adjustments to inpatient and community services. That memory assessment services would use the read codes, so we're able to accurately identify the prevalence rates. That within learning disabilities, we would be able to capture the total population of people living with learning disabilities, specifically Down syndrome, and offer them a well-being check. Number 5 was the health and social care should provide an agreed set of completed assessments and interventions when we're referring to a memory assessment service. Next slide, Tash. That memory assessment services will, within 12 weeks from the point of referral, provide a range of interventions to support diagnosis of dementia. The people access a contact that can provide emotional support throughout the assessment period and over the next 48 hours. So that would be a dementia connector model. That people living with mild cognitive impairment will be offered a choice of holistic services. That within 12 weeks of receiving a diagnosis, people living with dementia will be offered education and information that's important to their physical health and emotional. That people living with dementia, carers and their families will be offered learning, education and skills, so opportunities to identify strategies that will help. That all our health boards will be asked to adopt a dementia-friendly hospital charter, and in the next slide I'll explain to you a little bit more what that means for us in Gwent. That people living with dementia and their carers will have a named contact. They'll offer support, advice, signposting throughout their journey. So from the point of diagnosis through to end of life. And that includes carers assessments. The people living with dementia will have access when needed to health services. So taking a holistic approach, looking at physiotherapy, dietetics, those type of services. The people living with dementia have a current face-to-face appointment where a physical health review is required, and that could be primary or secondary care. That within 12 weeks of a diagnosis, the person will have an opportunity to have discussions around planning for future care, including end of life, identifying what their advanced care needs might be. Number 16 is for the organisations and care settings where they already provide intensive care treatment. They will have dementia care mapping as routine practice. I appreciate that might not mean very much to you at the moment, but I'm happy to take any questions and offer you some more information about that specific intervention of care mapping. That all staff at all levels, at all disciplines and within all settings will have the opportunity to participate in person-centred learning and development. And the people living with dementia and their carers will have support and assistance to engage in appointments, again, whether that be primary or secondary care. But if or when a person living with dementia has to change or move between care settings, this will be appropriately coordinated and adapted to the change in the environment. And lastly, Standard 20 is that working in partnership, the region will deliver on the required set of data standards. So the measurements, how do we know we're doing this well? And the reporting assurance structure will be in place. So I said it was a whistle-stop tour, so there's an awful lot of work that needs to be done. That's in the initial 20 standards and the 100 standards going forward. So this is the national model. So Improvement Cymru suggested that all regions divide those standards into bite-sized pieces of work that's delivered through these various work streams. So the next slide, Taj. So this is the model that we've chosen to go with within Gwent. So you'll see that there are work streams leads for each one of those work streams, and each one of those work streams will take off so many of the standards and to deliver what will that look like in each one of the areas of Gwent. So once we've got those work streams in place, which they are, and the abbreviations below here tells us who's leading on them, so we've got a clear point of contact. They deliver highlight reports that says how we progress on each one of those standards. And those highlight reports are then delivered to the Gwent Regional Dementia Board, who feed into the RPBs, and also into the overarching national steering group that's obviously delivers then into Welsh Government. Next slide, Tash. So we said standard workstream 4 looked at the hospital charter. So the hospital charter was about making a clear statement that we wanted all our hospitals to be dementia friendly. The charter itself, again, offers another series of standards that informs people, carers and staff what they should expect when they come into hospital. And the fundamental aim is to support wards to implement person-centred dementia practice. So there's numerous feedback that we've had from community health councils, patients, carers and staff. And this supports the feedback that we've had from people living with dementia, who say the charter will improve the experience of people affected in hospitals and care settings. Offers an experience that recognises the personhood, diversity and preferences shaped by recognising the importance of dignity and respect and kindness. So everything that we do will be informed and developed with people living with dementia. So what we've done so far, so we've developed our work streams. We've looked at our current dementia action plan that Natasha started the presentation off with, and we reflected our current aims to stand side by side with the standards. We are looking at the hospital charter. Like I said, that was launched in April, and we're in the state of readiness year. So by January, we're expected to present these reports to Welsh governments to assure them that we are working in a systematic way to deliver on the standards. We've already set up expert by experience groups, and now we'll work alongside our dementia-friendly communities groups who are already in place, and that's so that we can ensure that each one of these standards are co-produced. And we've run a series of webinar events, so and inclusively as possible. So we've had the BSL for people with hearing or deaf community. We've done ethnic communities. We've had hard to reach areas, as well as offering these now in each one of the regions to highlight what we're looking to do in Gwent against these standards and improving dementia care. So that was, again, sorry, a whistle-stop tour. A lot of information we granted was part of that. But to say, although we are working on these standards, there's an enormous amount of work that's being done within our specialities, within our region and around our dementia-friendly communities that we're not highlighting as part of those standards. But that work doesn't stop because we're looking at the standards. So they sit side by side. So happy to take any questions that the panel have got to offer us.
Okay, so pre-discussion, thank you for that. That's very interesting, actually. You know, there are many people in this room that have obviously encountered, their parents have encountered, or family members have encountered dementia, so I'm sure that they will have a view on that, you know, their own experiences, and add something to this meeting. What I wanted to do really was try and break this down into kind of 3 segments. So the questions would be, you know, pre-dementia, pre-diagnosis, education, how we mitigate about the risks of dementia, diagnosis, and then after diagnosis, that journey, as you say, where ultimately where people are cared for initially, then you know, potentially then going into care homes. So I really wanted to centre the questions around that. We've got some set questions, but I just wanted to open this up then to really the cabinet member and then Jane to talk about, to explain then to members what our involvement is. Obviously this is partnership working. That's my understanding of it from my own personal experience. If you could expand on that, Jane, that would be really interesting.
I'm going to be really rude now. Oh, sorry, go on.
No, after you, Amanda.
No, ignore that comment. I'm really sorry. Apologies.
Right, thank you, Councillor Watts. And Claire is our partnership, service manager lead on this area. So if it's okay with you, Councillor Watts, I will ask Claire to come in to answer some of those questions and expand on that area for you.
Yeah, so to be clear, it was just a kind of overall view of how we work as the authority works. So it's specifically for you, Jane, how we work alongside the authority's role in this. Obviously, it's partnership working, and it was for you and really Tudor, as opposed to the other guys who've given this introduction to explain to members what we do, really.
Shall I take it anyway?
Well, okay.
Would that help?
I think that's our starting point, Councillor Watts, if that's okay.
Yeah, go on.
Sorry. So I am the service manager for mental health, and that includes adult mental health and older adult mental health, which includes dementia for the local authority. But we do. I'm really proud to say that actually Monmouthshire works very closely with R&R and Bev and colleagues. We're the only Gwent borough that has social workers embedded in the community mental health team. So that means that people get an integrated service, and it's very joined up with health. They have one assessment, they have one care plan. So the service that individuals receive, I believe, is one of the best in Gwent. And outcomes for people is obviously much better. So our social workers are actually working with community psychiatric nurses, the occupational therapists, the psychiatrists, psychologists, memory assessment services. We have support workers embedded in the team. So it is a really joined up approach to working with people with dementia in Monmouthshire. And I think that Amanda would agree that we've got a really good model in Monmouthshire. And actually it has been commented on previously by Welsh Government at conferences I've been to, that Monmouthshire actually do what the legislation says that we should be doing for people with dementia.
Okay, brilliant, thank you. I'm not really sure, and I'm going to ask members. Do you want me to run through the generic questions that we've? Okay, yeah. So you've kind of answered the first one already. What are the responsibilities, and what are those partners? I think we've covered that already. Would members agree about that? Yeah. Okay. So what support is provided before and after diagnosis, which kind of leads me into what I was saying earlier, really. And then if that's all right with everybody here, we kind of expand those questions around that. Is that all right with you, members? Yeah? Yeah, okay. So, yeah, so the question is, what support is provided before and after diagnosis?
Okay, so from a local...
One second, Penny wants to come in as well.
Sorry, I just noticed in standards 11 to 15, Amanda, you've got 48 hours after diagnosis as contact regarding emotional support, and within 12 weeks support for future to the end of life. I just wondered, on top of the question just being asked, how realistic this is in present day, you know, with staffing problems, etc. It's a fantastic aim and objective, and I realise we have to have those, but just realistically, how probable is it that this will all be carried out on all people who need it? Thanks.
So recognising you had two parts to your question there, and I think Claire was going to answer, but if I can just pick up then on that specific standard. The reality is that there is a lot of work to be done. There's an incredible amount of work that's already going on within the regions, and it's not about taking down what we're already doing, but adding to and restructuring. So the work stream, which is 2A, that are looking at the pathway for memory assessment services. So that's the structure, as you said, part of the standards, raising awareness and understanding. So how do we get the message out there really early on that services are available, to have those discussions before we get to the point of diagnosis? So the pathway looks at the whole journey. So it takes into consideration the point where people recognise there might be something wrong. Where do they get the support? How do they get further reading? So there's a whole work stream group which is multidisciplinary, multi-agency, and they look at what we've already got. They do a scoping exercise. Where are the gaps within our current system, and how do we fill those? Now, some of those gaps are just remodelling what we've already got, but some of those are identifying that we need additional posts or services or skills within that workforce. So this is the stage where we're looking at that readiness, and then from that there is money that comes from Welsh Government as part of the regional investment funds. So we do have an opportunity to bid for those funds to support that programme. Now, stressing that this is not about money, this is about looking at what we've already got, making it as efficient and as effective model as we can, making sure it's responses, as Natasha said earlier on, that we are responding to individual needs at the right time, so we're not wasting resources. So how realistic is it? It is realistic to be able to build on these things, but it takes time to remodel existing services and making sure that people have got the right skills and expertise and the structure in place.
Thank you.
Okay, thank you. Thank you very much for that. So the next question was, okay, so how we work alongside families to support them if family members have dementia. I'm going to throw in a second, what differences are evident as a result of the pandemic? So there are two big questions there. And then, I might as well throw in the final one. Sorry. All right, I'll let you, sorry, I'm just being involved. So basically, I'm going to let you answer those questions and we'll move on to the next one.
Okay. So I think from a Monmouthshire County Council point of view, it's not necessarily just about services. I know Amanda's talked about services, and that's obviously part of the action plan. But within Monmouthshire, you know, if it comes into the local authority, some information that somebody might be struggling or wants some support, then obviously we would offer an assessment under the Social Services and Wellbeing Act, and we would support people to meet their own needs and signpost people to services that we've already got within Monmouthshire. And as Amanda said, we're going to be expanding services that are available to people, but you know, that sort of early intervention and prevention support that we've got, there's lots going on in communities where people can be signposted to groups that are running, and it doesn't have to be dementia specific, because we want people to be able to continue to engage in activities that they would have been doing prior to any issues that arose, and it's about signposting people to as I say, any group that they're interested in the Alzheimer's Society have obviously got support networks for people to link in with dementia cafes. So that's sort of the low level early intervention and prevention. But if we did an assessment for somebody under the Social Services and Wellbeing Act and felt that actually they did need some more support from statutory organisations, then we could provide support under that piece of legislation, and that could be day services or respite or care at home. So yeah, we're meeting need that's appropriate to the level of the dementia and proportionate to their needs. We do an awful lot of work with families rather than the individual in the later stages of dementia, because very often it's the families, as you were just saying, Councillor, that they need the support. So a lot of our work is with families. We would offer carers assessments, but when social workers and CPNs are going out, they're doing that day-to-day support with the carer to help them to cope with the demands of their caring role. And very often care packages are put in to support the carer in providing care to their loved ones. So very often it's about giving them a break, because it's hard work, as people will know, to constantly be looking after somebody with dementia. So, as I say, respite can come in many forms. It doesn't necessarily have to be going into a residential care home, which we do organise, but it could be a carer coming into the home to either take the person with dementia out and help them to engage in the activities that they wanted to do, or to sit in the house with the person so that the carer can go out. And we do have support workers, as I say, embedded in our teams. They've done some amazing work, and it really supports carers to carry on for longer. And just picking up on your bit about the pandemic, I think that's what happened in the pandemic. People were afraid of letting their loved ones go into care homes. So we were providing more support perhaps at home, or the carers were perhaps struggling to maintain the status quo at home because of, I mean, we all know what happened in the pandemic when people went into care homes. There was that fear about they were going to catch COVID, or they had to be isolated. The person who was going in had to be isolated for a while, which obviously is not good for somebody with dementia. You're already placing them in a different place, and then making them stay in a room, it wasn't a good experience for people. So our carers were supporting people at home more. And I think that's probably a theme that's carried on, to be honest. We've got more people now who are at home with increased needs from dementia. And really it comes to an absolute crisis before people are going into care homes. So people who are going into care homes now have much more significant care needs. And they're going into perhaps nursing care rather than residential, which they perhaps would have done previously. Does that answer your questions?
Yeah. So if I may, just to kind of, if I can, colleagues, if I just expand on that point. So you're saying that people are more reticent of kind of letting their family members go into care homes, and that you're investing more in provision in supporting people in the home, as opposed to then, so that by the time they get to kind of go into nursing homes, they do literally need some kind of, not, I know I'm generalising now, but would you say they're more likely to need more intensive care, which is effectively a crossover into, say, nursing care as well? Is that the
absolutely
case? Yeah. Okay.
Yeah, I think it is. Yes.
So sorry, if I may, just with that in mind. So if it's specifically to do with Monmouthshire, sorry, I know you're coming up, Sue. So sorry, I thought you were waving at me. So with that in mind, if you look at specifically the demographic of Monmouthshire, and we talked about this committee before, and I've talked about it with Jane and Tudor as well. So the average working age of someone in Monmouthshire is 46. That's disproportionately higher than probably pretty much anywhere else, I think, in, well, you know, in Wales. It's fairly high compared to, say, Newport, Cardiff, or even Bristol. With that, knowing that potentially then is a ticking time bomb, are you having discussions now about that specifically for those areas, not just Monmouthshire, but those areas across Gwent that have a disproportionately high amount of older people, or, you know, that where people are more inclined statistically, you can obviously identify those areas where people are coming forward at an earlier stage, having dementia. So that's a very broad subject. I know we could, you know, I could, to be honest with you, I could sit and talk to you about this forever and a day, but I'm chairing this committee, and there'll be other questions coming up. So if you could just kind of quickly answer that, if that's possible. I do apologise.
We are very aware of the demographics in Monmouthshire. We're aware that, you know, we're going to have many more people with dementia living in Monmouthshire. We're also aware that there's more accommodation being built in the Monmouthshire area for older people, and that in itself brings more people into Monmouthshire who potentially could end up experiencing dementia, and the pressure that will put onto services. So yes, we are very, very aware of it.
Okay. Sorry, Sue, you've got a question, then Jan's got a question.
Sorry, Chair, when I put my hand up, it was before you differentiated between the pre-diagnosis and what have you, so...
Okay.
Yeah.
You've had your question answered, okay.
Yeah,
Jan, if you wouldn't mind.
Yeah, mine is really about how the funds flow.
Okay.
You know, we have a carers shortage, I know, you know, and it's all related to the hourly rate and so on. So bearing in, this is quite a difficult question that I'm going to pose now because I'm just formulating it as I'm going along. We're talking about the older demographic. Are we sort of modelling, are we looking forward and you know, realising there's going to be that many more, or we're anticipating that many more, and where is the funding going to come from for that? How are we going to keep those carers?
Yeah, so that's a great question, Jan.
Big question, I'm afraid.
It's a very good question. We are doing modelling. We're actually looking at workforce modelling as well around the needs of individuals. But yeah, where the funding's going to come from is a huge question that we probably don't know the answer to at the moment. We know that although we've got 2 community mental health teams in Monmouthshire to work with people with dementia, the social worker component of that is tiny. We've currently got 2 social workers covering the south of the county and 3 covering the north of the county with a manager over. And then, as I said, we've got a couple of support workers embedded into that. We have managed to increase our workforce through additional money, so that's the RIF money. But as you know, that's a tapering funding stream. So we've got 2 posts in our older adult mental health team that are funded via that process and are at risk.
Thank you. That was a really good question there. So if you look at so to kind of press on that point there, you say you've got 2 social workers covering the south of the county. Sorry if I apologise to Judy if I'm just fixated on the south, but it just makes it easier for me to kind of ask these kind of questions. So if you look at the kind of the number of people that are coming forward, so I'm expanding on Jan's question, and then we're anticipating and trying to model in what the future looks like in, say, 5 or 10 years' time. How many social workers can you anticipate that you would need then to cover that? You know, are you starting to kind of be concerned that, as you've already mentioned, you intimated that it wasn't sufficient enough. I guess, you know, the south of the county, the expansion of the population is being rapid since everybody's decided to move over from Bristol. I know I'm generalising, not everybody's come from Bristol, but a large proportion have. That responsibility falls on our shoulders, isn't it? And then, you know, on the back of that, within that, how, on the other services, how do you expand then the support network? How do you involve the families into providing that service? Sorry if I'm replicating the previous question, but if you could expand on that, that would be interesting.
No, that's fine. I think we're actually undertaking, we've gone into partnership with Mind and the Mental Health Foundation, and we're undertaking some research at the moment, specifically for Monmouthshire, looking at carers' needs for residents of Monmouthshire. So that's a really interesting piece of work. It's going to be taking 18 months. We're about 6 months in now. So they're looking at us locally, then they're going out regionally and then nationally, so that we can see how we compare with other boroughs and other organisations. But that will be fascinating to see the results from that piece of work and what people feel is going to be most useful for them. And then we do have a small pot of money where we will look to see if we can provide what carers are asking for with that money. As far as staffing goes, I think it's worth also saying that we obviously do have our integrated services that have social workers in there as well. And integrated services do work with people with dementia. Our social workers in the CMHTs are working with people with very complex needs. So the community mental health team is a secondary care service. So those two social workers in the south of the county are working with their secondary care colleagues in health. And as I say, if somebody's in secondary care mental health services, they're probably more risky, more complex, and needing a multidisciplinary approach. But that is going to increase, we know, because of the demographics of Monmouthshire. I couldn't tell you off the top of my head how many staff we'll need, but I know that we've got a small waiting list now.
Yeah. So I'm going to bring in Tudor. Tudor's had his hand up for a while.
Yeah, thanks, Chair. It's more of a comment really, because I was going to come in earlier on, but we went into questions. But from a sort of cabinet member perspective, and yeah, I would not pretend to be an expert in this area. I would obviously look to particularly Claire and to Jane as head of services. People are obviously expert, but certainly from a political point of view and in my own sort of personal perspective, dementia is certainly very much a priority, because it will affect probably every family in the country at some point, and all the points you've said already, and won't go over it, but the demography, the number of people now in Monmouthshire over 85 is increasing rapidly. People over 65, people coming in because their kids have had jobs here and they want to live near them, but they will need help. But in my perspective, the only way that we're going to tackle this, because it is almost bordering on a sort of a tsunami in the future, isn't it? It's going to become, and it is a key priority, but it will become even more of a priority. But in my view, and I know that the previous chair of the previous cabinet lead pushed on this, was the fact that we've got to work through the regional partnership board, which is the board that has money directly from Welsh Government, which is then fed out through the regional investment fund. And it's such large amounts that we as an authority could not find all that money ourselves. And obviously Crick Road development, much of that is being paid for by the regional partnership board, something like £4.5 million, and that is a home which is all on one level and is dementia friendly. And the other thing two things I'd say is, one, we're moving more looking at microcare as people living in the area who can lend support quickly. And I was in a meeting with Jane Rogers on Thursday when we were talking about more microcarers coming online, so that we can have people close to hand, but also the issue that we're going to have to sort of face is that the regional partnership fund, as Claire has said, is being tapered, which is basically it's going to be slowly sort of cut down and tapered off. And as everybody knows, every authority is in sort of difficult financial circumstances. And lastly, the thing that I would say is every authority is struggling to recruit for a start, but then importantly to retain care staff, and I could go on about that forever and a day, but that is a priority for us. So certainly in terms of my perspective, then this is something that, you know, is very high on the agenda in my brief. Thanks.
No, thank you, Tudor. I like the way you conveyed that. You said that with commitment, and I really appreciate that. And I know you're, you know, I've had many conversations with you about this on, you know, separate arenas, and I appreciate you really get it. I've got Penny with a couple of questions now, so I'm going to bring in Penny. Thanks.
Well, it's just a follow up on the Oh, sorry, has it gone off again? Sorry, did you hear that? It's to follow on from the micro carers comment that you made, Tudor. But I wondered, realistically, Claire, are we using volunteers? Are we planning to use volunteers, trained volunteers, to help, you know, relieve the system in the community? Specifically those dealing with dementia. I don't mean just general volunteers, but specifically with dementia.
We are currently using volunteers, probably not as much as we could, and that's where the early intervention and prevention agenda comes in. And I know that Fred and Ash work very hard to, you know, work with people in the community. I think it's something that we could definitely take further and probably provide training, Amanda, couldn't we, around, you know, to volunteers to support them with individuals. Do you want to come in there, Amanda?
Yeah, do you mind? Yeah, so absolutely. So we've got several arms already. So it's about linking all these services together. So for the health wall, we've got the Friend in Me volunteer service. So there's a service that works under a patient partnership program, and they recruit people for dementia companions, so people who support people at home with dementia and other ailments, but as obviously as part of that program, we right way through to end of life volunteer champions. So there's probably about 5 or 6 volunteer programs, and they also link in with the colleges, universities, and the educational establishments. For example, there's 50 students from the pharmacy that we're currently working with, and then part of that is their volunteer hours, and we identify specific areas where they can go out and support people to befriend. So there's lots of programs. I haven't done that justice because I don't lead that team, but I'm very aware of the work streams that they are developing. But importantly, it's the support and workforce that goes along with that. So when you develop a volunteer scheme, you also have to have the governance and the support and the peer and the specialities to support them as well. So it's really important we're looking at that, but not to minimise the amount of work that needs to be put in to develop a programme such as volunteering as well.
Thank you. That's good to hear. Thank you.
Sorry, I'm just going to ask a couple of questions then, and when those people then go into care. So specifically about the existing resources. So Crick, I haven't been to Crick. I think actually Councillor Eason was trying to organise a trip there. I don't know if he was preempting anything, but you know, I would really like to have a look at that. I understand it's an excellent or potentially an excellent facility. I'm sure other members would. So I was going to ask the cabinet member if he could through Jane to invite us along to that. But that really covers that replaces effectively the existing provision we had for Chepstow, which I think we sold the site. That a developer will buy that. It's prime property. But effectively, numerically, we're just replacing like for like. So in light of what we said, what kind of pressures then financially are on us then to then accommodate more people in larger care homes? When we've talked about best practice, and we've talked about new ways of working and all the rest of it, but we're obviously ultimately going to need more care homes. What provision are we making financially for that in the long term if we're just effectively replacing like for like? And my second part of the question is and I'm not looking, I promise you, I'm not looking to have an argument about the re-centralisation of adult social care or any of those kind of, but rather controversially, the dementia unit moved from Chepstow Hospital back into Newport. With that re-centralisation and that service, have you noticed any difference because You know, we're moving people effectively away from their families. And then my final point is, and I'm sure that you've probably covered this already, or you've already kind of thought this out, but as a councillor, I certainly last term I was getting a number of concerns and complaints pre-COVID that we were moving them, because we didn't have provision in care homes, we were moving then dementia patients further afield. So, for example, someone in Chepstow might end up in, say, you know, Ebervale or whatever. That's obviously not very conducive then for the well-being of that person and the family's ability to go and visit, is it? So does that practice still go on? So there are a number of questions there, and after that I'm going to wrap it up. So if you wouldn't mind just answering those questions.
Can I take the first and the third together?
Yeah.
Because I think they're related. We don't have enough EMI residential or nursing beds within county. Over the years, we've had care homes that have closed down. We do have to source beds from outside of Monmouthshire. And one of the things we're finding specifically at the moment is, because people are staying at home longer and because their needs are so much more, that sometimes local care homes can't meet their needs anyway. And they are having to go much further afield in some cases, which is really unfortunate, and for the families, you know, can be quite devastating. But obviously the market is, we only have one of our own local authority care homes for Monmouthshire, and as you've rightly said, it's currently Sevenview. It's going to be Crick Road, but that is EMI residential, so it won't meet the needs of the very complex people who've got perhaps challenging needs or who have nursing needs, although we are currently looking at that to see whether there's anything we can do about that. But, you know, it's an open market. Most care homes are privately owned, and they choose the category of care that they want to deliver, and whether it's cost effective for them. So we are very much at their behest, really. The second point about the wards, yes, I know that was very contentious at the time, but we were given money. We were given £200,000 to Monmouthshire for investment into services for the residents of Monmouthshire. So our 2 support workers that we've got in the teams is currently funded by that money, and we have a respite bed within Monmouthshire for EMI nursing that's funded from that 200,000.
So if I may, so prior to that, you had 2 support workers. How were they funded before that?
No, we didn't have them prior to that. They came from that £200,000 funding.
Okay. All right, carry on. Yeah, sorry.
And we've also got a transport service out of that 200,000, which took up some of the difficulties with people getting to and from the ward. To be honest, I haven't heard many issues about the fact that the ward, because there's one in Pontypool as well for the north of the county, and Ebervale, I believe, Amanda, isn't it?
Yeah, so county's not dementia, county is functional.
That's right, yeah.
So I used to manage Monmouthshire Older Adult Mental Health and Blaenau Gwent before I took up this post. So, and Chepstow very much went to the Newport, Royal Gwent area and St Woolas, and then the Abergavenny, so Monmouthshire, the north, then went to Ysbyty Tricwm, which is near Vale. And there were hurdles initially, but a lot of those hurdles were overcome by the services being there to support the transport and so yeah, there were initial challenges there. You'd have to speak to the current leads to identify if there are any issues with our at the moment, or whether that's stabilised, I suppose.
Yeah. Okay.
And I think the other thing that we have done as a result of refunding and the closure of the ward is that we've dedicated a worker to anybody who is admitted to the hospitals, so that the wards and the relatives know who their nominated social worker is. So that's made communication easier as well.
Sorry, before I bring in Dale, how many admissions would you say you get on a quarterly basis?
Oh, I have got the statistics. We have far more people, older people now being detained under the Mental Health Act because of the changes under the Mental Capacity Act. So whereas previously we would have had very, very few people detained under the Mental Health Act, older people, at any one time, I would guess we've got probably about 4 or 5 individuals in psychiatric units.
Yeah, but how many people then out of those 4 or 5? Obviously, not all of those people will be detained. Sorry, so those people that are presented to you, not all of those people will be detained. I guess I'm just concerned about capacity. So I'm broadening this out a little bit. But you know, how many? Sorry, if you've got the stats, it would be helpful. If not, you can. I'm sure you could send them to us.
I'll send them across.
Because I'm just concerned about that if you've got one person effectively as some form of liaison between the families, is that sufficient? You know, when you look at the overall increase in demographics. Sorry to go back to that.
It is at the moment, but I think people who are on psychiatric wards now are more likely, if they've got a dementia, they are more likely to be detained under the Mental Health Act. So there's not many people with dementia who are admitted informally anymore. And that's because under the legislation, they're deemed to lack capacity to make an informed decision about informal admission. So we have to give them a legal structure in which they can be admitted under. So unfortunately, we are having far more people with dementia being admitted under the Mental Health Act.
Okay.
And that then impacts obviously on our approved mental health practitioners. The numbers of assessments is going up, and our approved mental health practitioners are our AMPs, and they are the social workers who are in the mental health teams. So not only have we got very small numbers of social workers in the mental health teams, they are also our AMPs who are undertaking these assessments in the community or in hospitals to detain people under the Mental Health Act.
Okay, those are really interesting answers. Dale, I'm going to bring you in.
Thank you, Chair. The £200,000 that came to yourselves when they closed the dementia ward, that has supplied us with 2 support workers in the south of the county. Once that money's gone, do we keep the 2 support workers in the county? What happens afterwards? It sounds almost like we've been paid off.
So the £200,000 is recurring money. That's not RIF money, so that won't be tapering. The 2 support workers are funded from the 200k, but the 2 social workers I spoke about previously are funded through RIF money. Every year we have to present to the Integrated Service Partnership Board for projects to be funded under the £200,000, which is awarded from an Iron Bevan. And year on year, they've agreed to fund the support workers and the respite bed, and then they fund other projects that are presented. So I'm basically keeping my fingers crossed every time I go back to ISPB that we'll get that money funding those support workers. So that's currently the situation.
Yeah. And I just wondered on the back of that, Penny made a really good point. What we could do with, certainly for this, for the council, for this committee, and certainly for the cabinet members, to get an update on that. Is that okay?
In a year.
Yeah.
In a year, approximately. Yeah.
Yeah.
Obviously, we're mindful of this, and we are genuinely concerned, really. Listen, I think that. Is there any other questions? Oh, Tudor's up.
Yeah. Sorry to come back in, but really quickly, and I'm not on the sort of the technical and nuts and bolts, and I'm really grateful to Claire here with a sort of encyclopedic knowledge of of what's happening in Monmouthshire. But I do think a major issue, and challenge for us as an authority is geographically it's such a large authority, and I hadn't realised this until I took on this role, and I've spent time now down in the south of the county quite a lot. But if you look at Torfaen, it's something like 3 miles wide and 12 miles long. If people complain to me in Abergavenny, why is my mum, why is my granddad in Severnview, and I live in Abergavenny, and I want to visit him or her, and I think that is a big challenge for us, and it's a big challenge for people like Claire and for Jane, who are in the service, in trying to meet all those needs across a really far-flung geographical area. It's not as big as Powys, but it's still quite a long journey from the north to the south. But I just make that point. Thanks, Chair.
Yeah, thank you all. Are there any other questions from anybody? No. Listen, I'm going to say thank you to Amanda, thank you Claire, and thank you Natasha for coming along today. You've obviously shined some light on this, and you've answered all the kind of questions, and obviously, naturally, you're going to raise more questions. We're an inquisitive bunch on this committee, which I think is a healthy thing. So, look out for next year. But thank you all for coming along, and thank you very, very much. It's a heartfelt thank you for the job that you do and the service that you provide. Thank you so much.
Thank you very much.
All right. Bye-bye now.
Bye.
My pleasure. Thank you.
Right. So, thank you, members, for those really interesting answers, really interesting questions. So next on the agenda is the draft Gwent Wellbeing Plan, and it says the consultation with the Scrutiny Committee on the draft Wellbeing Plan. So we've got officers who have moved from the hockey-style arena bit at the back.
Hi, Sean. Hi.
Yeah. Yeah, sure. Have you got your screens on? I was just waiting for your screens to light up, so I knew you were ready, really. I just didn't want to put you under unnecessary pressure. Normally you guys are welcome to come and sit down the front here in advance, that you don't have to sit at the back. Right, so, if you wouldn't mind.
Good morning, everyone. I'm Richard Jones. My role is Performance and Data Insight Manager at Monmouthshire County Council, and also work closely with the Gwent Public Service Board in developing its wellbeing assessment and plan. I'm going to initially take you through the paper today and the opportunity to comment on the plan in front of you, and then my colleague Sharon and I are happy to answer any questions. If you want to introduce yourself, Sharon, before we start.
Yes, thanks, Richard. Yeah, good morning, all. I'm Sharon Lloyd. I'm the Strategic Partnerships Manager at Monmouthshire Council. Work with Richard and the team there in terms of the regional approach around the Public Services Board and how we deliver this at a local level in Monmouthshire. So thank you.
Okay, great. So, whilst many are familiar with our Monmouthshire County Council roll on, we're also here today with our Gwent Public Service Board hats on as well. So the plan before you today is your opportunity to provide feedback and comments on the consultation draft of the Gwent Public Service Board's Wellbeing Plan that runs from 2023 till 2028. Just a reminder, the Gwent Public Service Board was formed back in September 2021, and the Gwent Public Service Board combined the 5 public service boards that existed previously within the Gwent area. One of the main reasons, amongst many, but one of the main reasons for founding the Public Service Board at a Gwent level was looking at how recognising that some of the wellbeing challenges within the areas are not unique. And actually looking at how some of those can be addressed at a Gwent level gives us a greater opportunity to succeed in tackling some of those wider wellbeing issues that are happening, that are at play across the regions. And one of the fundamental parts of how the PSB responds to that is in setting its wellbeing plan, which sets its objectives and steps it plans to take to improve wellbeing. The paper in front of you today. Lots of the work of the PSB, including this plan, is guided by the Wellbeing of Future Generations Act, and there's two main parts to that. Assessing wellbeing in the area for a wellbeing assessment, and then also developing a wellbeing plan. So just to, I guess, walk back a little bit to the assessment that's been undertaken to inform the plan before you today. That was an assessment undertaken by the Gwent Public Service Board, looked at the social, economic, environmental and cultural wellbeing of the area of Gwent as a whole. It also broke Gwent down into lots of smaller community areas, recognising that within Gwent there will be lots of differences in wellbeing within areas to identify those. And also in Monmouthshire, specifically, we also undertook a Monmouthshire level wellbeing assessment. And the assessment used a range of evidence from data, academic research, public engagement exercise, to look at the current wellbeing in the area, and also, where possible, what some of those future trends and future wellbeing may be. So the Public Service Board has considered all that evidence and has now set out its draft wellbeing plan that sets out draft objectives for what it wants to achieve, and then draft steps for how it wants to achieve them. And I think, I used the word draft a lot there. This is a draft plan. This is going through a consultation process, and there will certainly be more detail added as part of that, working with yourselves, but also a range of consultation of the partners who are part of the process. So the plan sets out 3 objectives at the moment. Those are: we want to create a fair and equitable Gwent for all. Second one, we want to create a Gwent that has a friendly, safe and confident communities. And the third one, we want to create a Gwent where the natural environment is protected and enhanced. And under each of those objectives, you will see a number of steps the PSB has proposed it will take. Another important part of the work of the Gwent Public Service Board at the moment is working with the Institute of Health Equity to look at how it will embed activity which aims to reduce inequality and equity between populations under the 8 Marmot principles are listed there under 2.8 of the plan. And that what's come out clearly through the assessment process is the inequality that exists within Gwent. And there's further work ongoing at the moment to inform the final plan about how those Marmot principles will be further embedded within it. So I won't go through them, but they're in 2.8 of the report. And that was one of the key pieces of feedback when the Gwent Public Service Board received its plan, as outlined in 2.9, that the stronger alignment and integration of the 3 objectives, including the embedding of those Marmot principles, is an important part of development. The consultation itself is currently running until the 31st of December. Then all that evidence that's been gathered from statutory consultees, working with professionals, working further with partners, as well as the community engagement that's running at the moment, will be used to shape and inform the final plan that will be published then no later than May 2023. And also, just to note, particularly from a Monmouthshire perspective, and there will be the equivalent local delivery plans in each of the areas, there will also be more local specific action plan that will fall out and link to the regional wellbeing plan and set out what we will do more specifically in Monmouthshire in partnership to address those issues. And I say there will be the equivalent of those in the other 4 areas of Gwent as well. That hopefully gives you a background about how the PSB has developed its plan, the evidence it's used, where it currently is in the process, and then the next steps in that process to finalising the plan. I'm happy to take questions and I suppose feedback, really, which is the focus of today, from yourselves to inform as part of the consultation process, the further development of the draft Gwent Public Service Board's wellbeing plan. So I think that's all from us. Okay,
Sorry,
Chair?
yeah, just before, I've got Penny who'd like to come in if that's all right. Oh, well, no, sorry, I'm just being too polite now. Go on, far away.
No, I think we're fine, Chair, on that. It's just really to give, as Richard's already outlined, it's here to give members today an overview of the draft plan, but really from our perspective to emphasise that it is draft and it does need refining going forward.
Thank you. So we are mindful that it is, thankfully, just the draft plan. So Penny, if you'd like to come in.
Yeah, well, first of all, I'd like to say thank you, but also that I'm not shooting the messengers, all right? It's not personal. Yes, I know it's a draft plan. I know it's the start of things, and they only just started, but this particular report is very difficult to give feedback on when there's nothing to give feedback per se, because there's not enough depth or detail. Now, I know it's Gwent-wide, so, you know, through the local delivery group, you're going to have a Monmouthshire Pacific report, which is really going to be welcomed, and I think that's the one we'll be able to give a lot of feedback on. But this, although it's generic, it should really have a little more depth, with some examples of how they're going to attain it. This could have been lifted, cut and pasted from the corporate plan, for instance, some of these aims and objectives. They're just so similar, you know, or some other portfolio. So I feel, in all honesty, I cannot give you any feedback because it is far too generic.
All right. Okay. Thank you, Penny. Have we got any other questions? Dale? Jan, do you want to pile in? No? Sue?
The only thing I would say, Chair, is I agree with Penny. It's a pretty vague document. I understand that the local boards will be the specifics that are needed for Monmouthshire, but it is pretty vague.
Okay. Steve? Sorry, sorry. Can you hear me all right, Steve? Yeah?
Yeah, I can. Yeah. You just moving my mouse quickly.
I'm surprised when I said Steve.
No. I was poised. It was just to say, echo everyone else. Based, you know, it needs a bit more clarity about who's responsible for each of the roles that are in the document. For example, in 2.8, you know, a bit more outline of, you know, who the members who are going to be responsible for each one. Looks like could be multi-agency roles, for example, in tackling racism, for example, the police and schools, but you know, again, how are we a bit more a bit more meat to the bone, I suppose, is what we need in terms of who's going to be responsible and how is it going to be measured as well. At any how these aims are going to be measured going forward and how we measure success.
Yeah. Okay. Are there any other questions? No. So my point is this really is just that I think if you're a new member, you might perceive this would be the norm. And I'm sorry if you really think I'm putting a boot in, but it's that generic. It isn't the norm. Normally we have a little bit more flesh on the bones here. So I think that, you know, the theme here, if I'm allowed to say this, is that I think it's important that we also take the message from, to go back to particularly kind of new members to say, look, this is not what we normally do. We normally kind of flesh these things out a little bit more. Am I allowed to say that? So you're not going to be offended and, you know, punch me in the nose or anything, are you? No. Okay. So, but I think the overall kind of consensus is that we can't really comment on it because there isn't really any significant points in there that would allow us to. If I'm right in saying that, am I Vice Chair?
Absolutely, that all the aims objectives is exactly what we feel and
yeah.
You know, recognise anyway.
So I think really we'll ask you to come back with something a little bit more interesting, if I may say so. Is that all right with you guys? Yeah. Do you want to?
Yeah, thank you. Thank you, Chair, and thank you, councillors, for the comments on that. We totally appreciate that there's probably far more detail that's required in this plan going forward. It is a balance, I think, for the PSB in terms of holding these at a high enough level to be able to drive the ambition across public sector in Gwent, but fully appreciating that it does need more detail in terms of how the PSB as a board at that very high level and strategic level does intend to make that change in terms of how they want to deliver the aspirations of their wellbeing plan. If it's just a comment to raise to members as well, this plan has gone before the PSB, and the PSB did say that whilst they appreciated obviously officer time and effort that's gone into producing the document and the assessment that's informed it, that they are looking themselves at more integration and more information to be going into the plan, particularly as we're starting to take the work forward now with the Institute of Health Equity, working with Professor Michael Marmot's team to make sure that we can start to embed that framework then as part of the wellbeing objectives that they've set currently. So the 3 themes that they've looked at with the data and evidence. So there will be more information, and we are going to be working with more professionals, and we are out for community consultation again with this plan currently. So there will be a lot more, we hope, coming forward on that plan. So we really appreciate the comments today from you, and the honest comments as well. So I don't know if there's anything you want to add, Rich, from your perspective.
I think you've covered that, Sharon. I think it's given assurance really to members that detail is part of the next step of that process. That actually looking then in more detail, which Sharon's described, working with a range of partners, the community, other experts in this field to pin down some of that detail. But you say the Public Service Board through this is setting its ambition. I think as the question rightly alluded to, this is about partnership working. It's not about one agency delivering these objectives. It's about bringing together multiple partners, working with our communities to deliver them. So it's setting that high level ambition. But appreciating you as a scrutiny committee will need we need further detail to understand that, and obviously then give assurance and accountability as well as not just to the vision, but also to then how it's being delivered. And as part of that, there will be also a development of a performance measurement framework, a management framework alongside the plan once those objectives and visions have been established in more detail to give some of that accountability. And I think, part of today is also, just reflecting, Chair, that in terms of the headline objectives and the steps, appreciating that the comments about the detail are those in sort of the right areas that the committee would expect them to be at the moment. And that basically just to check and reflect back with you and the committee is at the headline level, accepting the detailed comments, are they broadly in the right space?
No, I totally agree with you. You pretty much kind of, it's like you've read our minds, really. Jan?
Yeah, it was just a question about community consultation, community engagement. How are you going to do that? Are you going to do that sort of like an online thing, or are you actually going to physically go out and engage with the communities? And if you are going out there, can I just put a plea in for Goitra Vower? Nobody ever comes out and asks us anything. We've got lovely village hall in both Llanover and in Goitra, and you'd be very welcome to come out. Thank you.
Thanks. Thank you for coming along. I'll let you get on with your days now. Thank you.
Sorry, Chair, could I just ask...
Sorry, Dale, I do apologise.
When is the likelihood that we might get to look at the rejigged document?
So as part of the consultation process will end at the end of December. The plan will then be further developed. The regular process then would for this plan would then go to be signed off by individual bodies as part of the Public Service Board. So it would actually come back into the full council meeting for you to consider, and then gone subsequently to the Public Service Board as well. Obviously, we can also talk to you and working with the chair and Hazel as well about the local delivery plan as part of this. And I don't know if it's worth pointing out the development of the regional scrutiny's role in this at the moment. So that on formation of the Gwent Public Service Board, there will also be the establishment of a regional scrutiny that will oversee the delivery of the regional Gwent Public Service Board. And obviously you'll have a role then looking at more the local delivery aspects within Monmouthshire as well. So in terms of going forward, there will be those links between scrutiny, and that's currently just being developed at the moment. I'm probably not the best place to say any further than that, but that is being developed, and that's how the two will link together. And of course, as a committee, you'll be careful and informed of those developments, of the scrutiny arrangements.
Excellent. Thank you. Thank you very much, both of you. All right. Have a good day. Right, moving on to the agenda there. So we've got the minutes of the previous meeting held on the 10th. But look, you must pull me up on this. I should this is a rookie mistake, really. Did we have apologies at the beginning of the meeting?
We had one apology, Chair, from Councillor Francis Taylor, and then we've got a substitute, which is Councillor Riley for Councillor Bond.
Yeah, I'm surprised that Dale didn't hammer me for that, because he's run chairs for years and years and years and didn't notice the obvious mistake there. But anyway, yeah, thank you for that. So, go back into the agenda. So, yeah, that's it. So we've got the meeting. So if you want to look at that, do we accept that as a true reflection of the meeting?
Do you need a proposer?
I do need a proposer.
Propose.
I'll second, Chair.
Thank you. Okay, brilliant. Number 7, to consider the Public Services Scrutiny Committee's Forward Work Plan programme.
Yep, just to outline the plan for the next meeting, and these are ideas that you gave me back at the beginning of the sort of summer. Although actually these ones in here you didn't give me, I've suggested them for you. Haven't had some discussions with officers, but I think you did highlight the one about the Integrated Services Partnership Board. They receive a lot of funding. We need to understand their role and remit and how funding is distributed and what sort of service delivery we expect in Monmouthshire as a result of that. So we can look to schedule that for the 20th of February. And then perhaps a shorter item would be on the Early Years Transformation Programme, just to review the effectiveness of the service and identify any areas of concern. And members of the committee will probably recall that I've recently sent you a brief which sort of outlines some of the scrutiny items with a little bit more detail as to why, you know, we might be proposing that those are ones that you might want to look at. We haven't forgotten about some of the ones we haven't yet programmed in, which would be dentistry, and obviously we've got to program back the PSB report. But just to let you know, sort of under this item really, just to update on what Richard has said about the Gwent Regional Scrutiny Function for Public Service Board, I'll be bringing a report to the January Council asking for 2 representatives to be nominated to sit on that scrutiny function. Now, it would be really helpful if those representatives were members of this committee, because obviously we'd have a better sort of line of sight between the regional work and then local sort of things you might want to look at within this committee. But it doesn't necessarily follow that they have to be 2 members of this committee, but it would certainly make sense. So I'll be putting that report through to January Council, and please watch out for it. And nearer the time, I'll give you a little reminder that it's on the agenda. And if anybody from this committee wants to put themselves forward, it doesn't have to be the chair and vice chair. It could be members of the committee, but it can also be the chair and the vice. So that'll be in the new year. So that's it for the work programme, Chair. And then the Cabinet and Council Forward Work Programme is for noting. We just so that newer members are aware, we put this on every agenda, all the scrutiny agendas, so that you can see what decisions are being made by the executive. So if there's something on there that you think is of interest or you'd like to know more about it, you can get in touch with the officer, you can ask for the report, or you can have a conversation with them, or you can suggest that you bring forward an item for pre-decision scrutiny. So that's why we table it. We don't go through it, but it's so that we know what decisions are forthcoming. Okay, thanks, Chair.
I think that's important. Thank you for saying that, Hazel, about pre-decision scrutiny. You know, a lot of members wouldn't, again, that's probably not part of their, I don't think that's been part of their training, to be honest with you. But I mean, it's a really important point. So is everybody satisfied with that? On the 2 members then, what are members' views? You know, it's easy to forget about these things in between meetings. You know, there's kind of big gaps really in between meetings. Is there anybody that wants to come forward to sit on that committee? Penny's already put a name forward as the vice chair. I'm happy to do it.
Committee.
I'm happy to also put my name forward, but it's kind of, it's a bit predictable then. If there's anybody else, I know Jan's looking very enthusiastically on her phone there. I do apologise. Enthusiastically writing notes on her phone. To self, right. Sorry to pull you up, Jan. I apologise to you. So what? Okay. So what do you think, Jan?
Thinking about it.
Okay. Does anybody else want to put their name? Dale, Sue, you're only, you know, a guest really.
I'm currently time-strapped chair.
Okay.
So I won't be putting myself forward for this one.
If we liaise with Hazel in between and try and resolve this issue. So the cabinet, so really we're on to number 9, I think, of the agenda. So it's to note then the date and the time of the next meeting, which is on the 20th of February, 2022. 23 even. Yeah, go for it.
Just one thing for you to note, the budget scrutiny is being split between the other 3 scrutiny committees because it just doesn't really neatly fall with the remit of your committee. So I hope that's okay with you. Each of the other scrutiny committees are having special meetings during January and February. So the Performance and Overview Scrutiny Committee is meeting on the 25th of January in the morning. The People's Scrutiny Committee will meet the following day on the 26th in the morning, and the Place Scrutiny Committee will meet on the 2nd of February in the afternoon at 2 p.m. But you're welcome to attend all of those meetings, either to observe or to participate. I'm sure the chairs will be very happy for you to attend and ask any questions and participate in the scrutiny. So yeah, just to let you know, that's why you haven't got a budget scrutiny meeting. It just doesn't really fit with your external role. Okay.
Hazel, can I just ask there, with the other scrutiny committees, we don't, although, you know, you say we're welcome to attend, we don't actually get invited, do we?
Yeah, I was going to say.
I end up going on YouTube and.
I think with those, I'll send the invitation to all members, so you can either watch online, or you can, you know, you can come into the meeting if you like, but then you'll have the option.
That's
and that is something that I might think about doing for all scrutiny committees, to be honest, because I think at the moment you have to let me know if you want to have an invitation to attend and participate as opposed to observe. But I think some members, they do like to dip in and out, but it just is helpful if the chair knows if members are attending to and wanting to ask questions, just so that they can separate, you know, the committee from the non-committee. But I'll send the budget ones to everybody.
That's great. Thank you very much for that.
Okay. Well, listen, thank you all for attending today. Thank you to the officers for attending. As I say, I'll see you again on the, this committee will meet again on the 20th of February. If everybody's satisfied with that date, I assume you all are, and we'll make provision for that in your diaries. Just to say then, if there are any members of the public are, and I'm sure there are literally thousands of them out there watching this on YouTube, this meeting, and they've missed a bit, this is available on YouTube as well. This is recorded on YouTube. It doesn't, the format of it comes in the full entirety. It's not like Match of the Day where you just get the highlights and some punditry. It's effectively the whole thing all over again. But thank you all for attending.
Forever.
Forever, yeah.
Thank you, Chair.
All right. Bye-bye.
Thank you, Chair. Bye.
Thank you, Steve. Thank you.
Cheers. Bye.
Yeah, I'd like to